Here's the reality. EHR and related system testing is a tangled, messy burden that soaks time, it drains resources, and it hurts morale. At the end of the day, no health system can really afford that. Today, we're going to talk about some exciting new developments that are going to change that part of the world. Greetings, everyone. My name's John Farkas, and I'm going to be your host today, and I get to introduce you to three remarkable people. Let's start with Laura O'Toole. Now, I've known Laura for several years, and I'm here to tell you she is a determined force, and healthcare is lucky to have her fighting to improve things right now. She's the CEO of a dynamic new company called SureTest. And SureTest is giving health systems the ability to automate their entire EHR and related systems testing processes. And they're doing it through an expertly managed service program. I'm looking forward to the conversation we get to have around this. Welcome, Laura.
Thank you, John. I'm so excited to be here and excited to be here with Nickie and Eric especially.
Well, you're jumping the gun a little bit because I get to introduce Nickie and Eric.
As per usual. Okay.
Nickie Fuhrhop is also with us. She is the Access and Revenue Cycle Manager for IT and one of the key innovation leaders at Southern Illinois Healthcare. Welcome, Nickie.
Thank you. Happy to be here.
And also with us today is Eric Peterson, Senior Channel Manager for the Americas at Eggplant Software. And if you don't know Eggplant, you will soon. But Eggplant is really a remarkable platform that allows automation to take flight. And we're going to talk about how these different elements come together, how SureTest works with health systems empowered by Eggplant to really transform what is possible in automating testing. So it's a pain. EHR testing is a pain, but it has to happen. You have to find a way to test, but what I know is the demands on infrastructure are higher than they've ever been before. The budgets are more constrained in many cases than they've ever been before, and that equation just doesn't typically work. And so too often we end up with a lot of tension and rushed processes that leave us vulnerable to the kind of errors that nobody wants to see happen. And there's just not, to this point, there's not been a reliable way to simplify testing. Nickie, in your experience, does that ring true? Is that what you were seeing happen in your world?
Absolutely. There was a lot of demand on our teams to provide the end result to our directors and leaders and make them confident in the information we were putting into the EHR. They wanted to see the outputs. So we had a total of 21 FTEs sitting in a room for 2 weeks straight. And that's where we got engaged with SureTest and Eggplant and started to look at what are our options out there.
So let me get this right. You had 21 people in a room pushing through the testing process.
Absolutely.
I'm guessing that was a very expensive ordeal.
Yes, it was.
I'm also guessing that it was a lot of fun and everybody felt great all day long about what they were doing. Is that true?
No, it is not true. Those 2 weeks of testing that we were required to do was very stressful for the teams and a lot of frustration from our employees. Just, why do I have to sit in here? I only have one piece of the puzzle, and when my piece is done, I should be able to leave. We were talking through that, but what we would see is we would run a test script. The first phase of it would be fine, and then we get halfway through on day 4 and a piece broke. Well, the person, if we didn't have everybody in the room all the time, we couldn't just look to each other and say, what happened on your piece? Because although it was way up front, when we got to the back end, that's what caused the back end to break. So we really had to have those folks in the room just to be readily accessible. And the morale was terrible those 2 weeks. People were like, I'm going to take vacation. Somebody's going to fill in for us. I can't believe you're making us do that. Whenever I got involved with SureTest and Eggplant, and it was like, what can this do for us? And when I got the team together, I was like, if we can show this group what we need, I think that we'll be able to eliminate the need for people sitting in a room. And you guys can help us to collaborate, and we can still have the end result and provide the directors and leaders with the confidence that they need to say, we've tested and here's what your claim looks like, because we go from the front end to the back end with a clean claim.
So, Laura, I know that you are familiar with these kinds of scenarios. You've been involved in IT consulting in the healthcare space for 2 or 3 years at least. Maybe a few more? How many, Laura? Will you tell us?
How about 2 or 3 decades, John? But I really appreciate the 2 or 3 years.
So safe to say you've seen a lot of these scenarios. And that's been a lot of the reason that SureTest exists, because you were very well acquainted with the look and feel and trepidation that exists in those rooms that Nickie was describing. Tell us a little bit about how you brought this forward and what was the challenge that you were seeing that needed to be solved.
Certainly before even SureTest launched as a new company, we had a long-standing relationship with SIH and with Nickie and with the leadership, and had done a lot of work with them over the years. And Nickie is one of these leaders that is very diligent, I think does a fabulous job of really empowering her team to drive excellence across her organization. And a lot of different systems certainly test differently. I think SIH had a deliberate amount of rigor, largely because of Nickie and her team's leadership to make sure that there was great outcome. And I think she recognized that we were launching SureTest. And, I remember very specifically having the conversations, her saying to me, will this really work? And I think she knows that I mean what I say and I say what I mean. So certainly this was born out of a trusted relationship, and where we were able to take her drive for innovation and her drive to create automated process within her organization to really deliver an outcome for her team was really the cornerstone of this building and this getting launched at SIH. And we had seen this over the years that so many of our clients were struggling with this. It's why we're so passionate about this business. And SIH was a great partner. And actually today, of all our clients, they have the most number of their full patient journeys and workflows automated in their specific library as a result of the work that we did at SureTest and with Eggplant. Of course, though, led by Nickie's desire to really make a difference for her organization.
Laura, I know that every health system is different, but knowing what you've experienced with Nickie and the other clients that you've worked with, do you have an estimate, a ballpark of how many hours are spent on manual testing annually? What does that framework look like?
Yeah, I mean, I really think it depends on the organization, and you can never test enough. And so many organizations don't test to the level that they should to really provide good QA and confidence that their clinicians and end users are going to be using a fully tested system. And I think it ranges from hospital to hospital, but certainly in many of the ROIs that we've done across multiple clients, you're talking tens of thousands of hours. In some cases, we've seen hospitals that have 12 FTEs that have been able to be completely redeployed for more strategic projects because they are not doing both day-to-day testing. And as Nickie said, with the new upgrade releases that come from the key vendors in healthcare, there's a constant requirement to do smoke and regression testing somewhat, continually to do it very effectively. So it's tens of thousands of hours, John, depending on the organization.
Eric, what I know is there's a lot of health systems that have Eggplant deployments that are radically underutilized. They're not even touching the capabilities of the platform, and still have those rooms full of people doing, spending all those hours doing all that testing when it could be really different. What have you experienced in that regard?
Most healthcare organizations get into it for the EHR, the EMR side of it. They're facing security challenges with all the PHI that they have to protect. They're facing the funding challenges with, making sure there's enough budget to do what they need to do. And when they get into Eggplant, they have a sort of a linear line or single line that they're using it for. Eggplant is so much more than that. And you're right, it can expand to be an umbrella testing automation solution in one regard, and even get into robotic process automation later on for the end user. What we bring to the table is being able to overcome that security challenge, because the way Eggplant tests is it creates a digital twin of whatever application that you're looking at. So our built-in artificial intelligence makes it so that it doesn't really matter what the application is. We're going to build a digital twin out of it and make sure that there's no additional security threat vector that we've added into the system. So we don't have to put an agent on, we don't have to do anything like that. They really enjoy that part of it, is that they have that peace of mind that they know that the PHI is no worse for wear because we're bringing Eggplant into test.
So Eric, tell me, why are you guys excited about what SureTest is doing?
Yeah, I would say that, in addition to our technology, what we bring to the table for the end user directly, combining it with SureTest's ability to do the testing as a service and really make that financial leap from traditional human testing and manual testing into an automated testing situation is just made more palatable by SureTest bringing it to them as a testing as a service. Instead of trying to buy the licensing, find your internal testers, organize all of that, it just gets to be too much. So that's where our combination with SureTest really fits in well.
And Nickie, tell me how you've seen that realized. So you started in one frame with SureTest and Eggplant. How have you seen that expand through your organization, and what has it meant?
So we're looking at FTEs and how we can automate things. So we want to make sure that our people feel valued and they're doing work that's meaningful work. And so what we've identified is a few opportunities where it's basically just pushing a button and it's just going through the same process over and over again. So we're looking with our PFS director at options to automate some functionality within our PFS department where end users are just going to a website and they're looking and they're just copying and pasting, but they have over 1,000 accounts a day that they have to do that to. So the value for us to use SureTest is we're using 4 FTEs doing what they call button banana work, which is thoughtless. They don't have to think about it. They just go through the motions. We're going to work alongside with SureTest and Eggplant to automate that and then allow those 4 FTEs to really do the things that require a human to think about and to make decisions. And our employees have voiced that makes them feel more valuable and that they're using their brains to make good decisions and making their work meaningful to the organization.
That human part of it in the testing that they would set up, what we come in and do is not only are those employees freed from the banana button work, as she calls it, which is a great term. I may steal that.
That is a great term.
But they're always, most of those manual testers are going to set up the testing for what they think a user should do, right? So they get admitted to the hospital, they head to the ER, wherever it is. It's a pretty linear journey. There's not too many variations. But what Eggplant will do is come in and say, it's not what a user should do, it's what a user can do, right? And so we're going to go in with our artificial intelligence and say, okay, they may be testing for 2,000 different test cases or 3,000 or whatever, but there's actually about, 152,000 permutations. How deep do you want to go and how do you want to prioritize those? Because nobody's ever going to test for somebody hitting the back browser button 8 times, but they will, and they'll do it. And you have a peace of mind with Eggplant, with the SureTest, that that you've covered that what if.
It's so interesting, Eric, that you say that, because John, I know that you're aware, we looked at many solutions in the market in terms of who we really wanted to take our solution to market with. And we did a large evaluation, and Eggplant Keysight by far, in terms of healthcare and the complexities of healthcare, was certainly the solution that we felt very confident in all our research could really make the biggest difference for our clients. And as Eric was saying earlier, there's a lot of clients that have purchased Eggplant, and it's a wonderful tool, and have tried to get it deployed internally. But as you heard Nickie say, there's so many competing priorities. And one of the things that SureTest wanted to do very specifically was to offer our solution, as Eric said, as a managed service, because it's one thing to develop the scripts. It's another thing to develop the scripts the right way with the right kind of framework. But then it's a third thing to keep those scripts regularly updated so that you get the value and they don't get stale. And that's where a lot of our clients just they don't have the resources to do that. And in our solution, coupled with Eggplant's capability, we are able to maintain those scripts on a daily basis. And probably what's most important is to really jumpstart. If you look at the amount of time the development would take for a hospital to do on their own, by bringing in our library that's already been developed, that has over 1,500 workflows in it, we're then able to create with the client, like we did at SIH with Nickie, an individualized library that's very specific to that client's workflow. And they're able to get the benefit of our framework and the library that we spent a lot of time to build, to really jumpstart and take this great tool and drive value very quickly. That they would have to hire so many individual developers and staff in order to really keep it updated because of all their competing priorities and projects that they constantly have to deal with.
Yeah, that staff optimization component is a really critical element. And I know that there's a lot of playing referee between the business and IT departments to get the right resources for testing. Nickie, what was that dynamic like in your world?
So for us, the challenge was, as you said, getting the right people in the room at the right time to make sure that we got our end results. The biggest challenge for us was, at first we thought we needed to have UAT, where our end users are acceptance testing, but we were able to prove with SureTest and Eggplant that we could have these scripts that are very detailed. We had to be very detailed about how SIH was functioning, and we were able to show them, here's a script, here's your end result. Or even if it failed, we were able to present, here's the failure point, and here's how we're going to be able to resolve it. And that's the only time we had to bring our operational leaders, or if it failed and we needed to make a decision. Was it because something was built incorrectly in the EHR, or is it a human process that we needed to change? So the UAT, not only did we reap the benefits of analysts not being in a room, which was 21 analysts at one time, we also were able to leave our operational leaders and our users doing the job that they needed to be doing while the test was running, and then they had the end results. So while it was challenging to pull it all together at the beginning, I would say that the SureTest team was great. They came on board with us and said, what do you need? And we already had, here's our piece of paper. Here's everything we need to test, and here's where we need to go with it, and here's our outcomes.
What I understand is that we're looking at eliminating north of 80% of manual testing in most of these deployments. Is that true in what you experienced, Nickie? I mean, is it that big of a difference?
Absolutely.
I just can't imagine what that ends up translating to, but my goodness, that is got to be a significant savings.
Happy employees, happy leaders, directors. I mean, the morale itself is just so rewarding for them.
I mean, especially on the clinical side, to be able to let those people keep their focus on what they're meant to be doing, I've got to think that it's a huge transformation.
We've also seen some opportunities where, so our analysts, our IT analysts would say, they don't have time to be innovative because they're always testing, or SIH goes through 2 optimization cycles. So every 6 months, we're going through major projects and optimization cycles, which obviously you need to test for. So with this automation for testing itself, we've been able to allow and set aside time for them to be more innovative and to look at other things that we can do to make sure we're saving time savers and we're as efficient as we can be as an organization.
Eric, I've got to think that you're in an interesting position because you know what's possible with automation, probably more than most human beings on the face of the earth do, right? And so I've got to think you come into these situations and you're looking at how things are being done and you see what's possible.
Yeah, there's a great analogy that we kind of throw around sometimes, and it's great to see hospital systems and healthcare organizations like Nickie's really, when the light turns on, it turns on pretty bright and they get it. And a lot of times when we talk to organizations, their first comment to us is, well, we need a way to run our scripts faster. We have to get through these scripts because Cerner or Epic or whatever we're using is coming out with their next update. And if we don't get that cleared for us personally, here at our organization, we're going to be in trouble. And they really don't see the forest for the trees, right? What they're telling you is, I need a sharper axe to cut down these trees very quickly. And you hand them a chainsaw and they look at you kind of funny and go, okay, well, I just need a sharper axe. I'm like, well, try the chainsaw. It really is that kind of paradigm shift. and being able to do the work and to be able to get to what your really ultimate goal is, which is a zero defect general release on your version of Epic or Cerner or whatever the application is that you're working with. And people have just been so used to this manual testing or automated batch files where they have to go in and every time there's a .NET change or there's a screen change, they have to go back in and manually fix all that to make sure that it doesn't get false negatives or positives. And here you don't have to do that. We take care of all that with Eggplant, with SureTest's help of, SureTest has been into so many healthcare organizations that they just rinse and repeat in a lot of cases with the base accelerators and then customize it to that healthcare organization's needs.
That's really an important underscore here. We always talk about IT in the context of healthcare and how it is really affecting patients' lives. When we're talking about saving tens of thousands of hours through an IT implementation, tens of thousands of clinicians' hours, I can't think of many initiatives that a healthcare organization could undertake that could have that kind of transformational impact. I mean, there's just not many things that I can imagine that will cut loose that many clinicians to go back to doing what they're doing to care for patients. So that's point A. Point B is when we start looking at the accuracy, we're not just getting people back in with patients, but we're making sure that the systems are doing exactly what they're set up to do and performing exactly how they're intended to perform at a level that was not before possible because of how cumbersome it was. That is a radical change.
And it's mission critical systems that you're working with, right? So it's people's lives on the line. And if that software doesn't work correctly, you're jeopardizing potentially somebody's life. I will tell you this, and I would not be doing my job if I didn't mention this, John, that with Cerner and Epic and with those platforms that a lot of these healthcare organizations use, Cerner, for example, spins up thousands of instances of Eggplant a day to be able to make sure that their platform works correctly. And so they're offering that out to their healthcare organizations that rely on them. But we've really seen the uptake in the healthcare organizations, with Eggplant on an immense level.
Yeah, John, there's a big difference between, testing the code, the way that a Cerner and Epic needs to check to make sure that what they've developed is working as intended, versus the interaction of that clinician and of that end user for a specific workflow within an organization. And it becomes very important to make sure that what was intended for that specific workflow or patient journey for that specific facility or service that that hospital is delivering to their community works as they intended to work. So, that's really the persona part of what SureTest and Eggplant do for our clients. And, like Nickie mentioned, taking the initiative and the effort to implement a solution like SureTest and the capability of Eggplant when they had so many competing priorities going on, what we find, John, is that it's important for our clients to take the time to implement a solution like this based on what they know that they can get back. And I think one of the neat things that Nickie did was to say, we are going to be innovative. We are going to take the time to look at the solution, and we know we can jumpstart it pretty quickly. We have a trusted partner, and we're going to get it done. Because although we have so many competing priorities right now, if we do this, the landslide difference that we're going to get once we're implemented is going to be undivided. So I really do admire her courage with all the other competing projects that she had on her plate to see the value and see that doing a little bit of work up front and giving us a small amount of time from her end users and IT analysts, the value that she could drive for her organization.
So here's what I know. SureTest is a very comprehensive managed service solution. And there's so many competing priorities, so much challenge around resources in health systems, IT universe, that having the time, doing the work of putting all this together, even in the context of automation, can be a pretty difficult hill to climb with all that's going on. So a lot of the beauty of what I understand Laura, you guys are offering is in the fact that you can come in and just and make this happen, because we've been there. We understand the framework. And what you guys have done is put together a system that really is very easy to implement in the context of these systems. And what I've understood, and as I've talked to people that you've worked with, it's like, I can't believe it's this easy. I mean, it is really kind of a game changer. So I know there's 3 core components to what you have.
Mm-hmm. Yep.
It's the SureWorks library, the SurePersona Engine,
Mm-hmm.
and your core methodology. So talk us through those quickly and how that makes a difference for how you're able to implement this transformational level of testing.
We launched SureTest because we saw, particularly in the times of COVID, what our clients were going through and all their competing priorities and what we knew they had to do. So it was very important to us to take a lot of time and effort and money to invest in a solution and build out our SureWorks library. So as you mentioned, there are 3 components to our solution, and we couple it with our partner at Eggplant and Keysight. And what we've done is we've developed a SureWorks, what we call our SureWorks library, that has over 1,500 workflows, patient journeys in it, that we're able to bring to a client and very quickly allow them to jumpstart their automation based on our library. And what we do is we take a little bit of time, as Nickie mentioned, from those 21 analysts that were involved in her testing across the board. And, we spend about, an hour or so with each of them, and we literally record the workflow. I'm not going to go into, all the components of how we do that, but we are able to then take our SureWorks library and create for an individual client the SurePersona Engine that is their own workflow and library. And the reason we're able to do that is because we took the capability of Eggplant and built what I think is a very sophisticated plug and play. I liken it to Lincoln Logs framework to really maximize the maintenance of these test solutions and scripts. And as Eric and Nickie both mentioned before, Eggplant is a fabulous tool, and a lot of clients have the license, but it's built at times very linearly. And it's one thing to build it, and it's another to maintain it. So we created a methodology and a framework that controls for the overlap of situation that happens with a patient on patient journey. So, for example, everybody either gets admitted or registered. There's only a certain number of ways that you can do that. There's a certain way you can order a particular lab test. There's a way that information needs to make sure that it adequately gets to a claim. And where those things overlap, we built a very specific framework and methodology. And like I said, I liken it to Legos or Lincoln Logs that allows us to be very efficient in the development. And more importantly, it allows for the maintenance, the daily maintenance of that development to be maintained in a full managed service solution. So it does become completely turnkey for the client and they don't need to worry about it. We're running testing in their environment daily. So we're catching changes and break fix and optimizations that happen on a regular basis for our clients.
So one of the things I'm anticipating that some of the folks listening to this might be thinking, okay, I hear you've got this framework, but we have a lot of very specific solutions or very specific workflows. I can't see that working in my situation. Nickie, you do have specific workflows and ways you do things. How does this work for you?
We partner with SureTest and the Eggplant team, and we provide a script. So we write out the script to say, here's what we need it to look like, and this is how SIH does things. So when Laura was speaking about it's the patient journey, not only did we do the patient journey, but we also went to the end of the process and we actually produce claims. So it's very important for our organization and every organization to have clean claims. Our clinical teams didn't understand why they had to put in all this work because all they want to do is put in an order. Well, we wanted to make it very detailed and customized around SIH and what we expect our claims to look like. So our test scripts are built around SIH processes and what our expected outcomes for all the way throughput to a claim. So we produce 150 to 200 test claims just by running those test scripts over and over and over again to provide different variables. So we may have an instance where we're using a rural health clinic, and then the next time we log in a department, it's a fee for service. But we're able to provide that to our PFS director to say, here's what your claims will look like whenever we do this upgrade.
When you have comments from potential users that say, well, it's a very specific application, or it's this or that, Eggplant was built that, if you're using it to the full potential, eventually, it doesn't matter what the script is, what the software is. I'll give you an example. We get used not only in healthcare, but we get used on mission critical systems with NASA. And the reason we're used there is because you can't put an agent in. And so, we'll test like a human user would test, right? If we can see it on the screen, we can test it with Eggplant software. And so to really get a true umbrella type testing automation solution that you can use across the board and expand left or right from whatever application you started with, that's the real paradigm shift that we offer. And nobody else in the market really offers that.
So Nickie, and in looking at your test scripts, what we were able to do was bump that up against our library and then leverage what was in our library that was similar for a lot of organizations, and then fully customize specifically to your very detailed test scripts to provide the output on the claims that I know the leaders in your revenue cycle area wanted to see.
That's where the speed and efficiency comes in, especially in implementation, right? Because you've built most of it. And so you're able to take the parts that overlap and put them in place, and then just spend the time on the nuanced customization on either end of those primary modules that allow you to really quickly, easily, and most importantly, reliably happen, because you're dealing with frameworks that are tried, true, and consistently updated and maintained to make sure that they have great integrity.
The library that is available is very robust, and we're an Epic shop and we're going through our every 6 months upgrade, but we'll go from February 2021 to November 2021. And when we run our test scripts, that library is already updated to that November 2021. They know exactly what they're planning for that. So we can run our test scripts and it's already there. And we're not seeing those failures because the library is so robust and it's updated frequently.
So folks, welcome to the era of intelligent test automation. That's what we're talking about here. It really is transformative, and you have the chance to completely transform your entire EHR and related system testing process and literally redeem tens of thousands of hours every year. We're talking about a truly turnkey solution here, and it's based on what Laura was talking about. I mean, some rigorous expert methodology that they call SureWorks, incredible extensive library of constantly updated test scripts, and combining that with the SurePersona Engine, which is a powerful tool that precisely emulates your end user experiences and validates the workflow so quickly that it's going to change your entire approach to system upgrades and new implementations. Here's what I know. If you've got some skepticism, if you're not quite sure if this will work for you, I know that the folks at SureTest are really eager to put you in contact with some people that can help you understand why it will work. So Nickie, thanks for joining us today. Really excited about what you've been able to do in the context of your system, and thanks for sharing with us today.
Thank you for having me. It's exciting work. I'm excited to continue to work alongside with the SureTest team and the Eggplant team. Lots of innovative ideas coming out. I always challenge my team. If you're going to push a button and you expect a banana to come out, then let's see if we can have Eggplant help us with that.
That's great. And Eric, thank you for your work here. Super excited about what Eggplant is affording in this era of intelligent test automation.
Yeah, it's an amazing time to be in application management and testing, and glad to be a part of it. And we'll keep doing some more groundbreaking work. So thank you very much, John.
And Laura, SureTest is really bringing it all together in some ways that are changing the way things are getting done. And I've got to think you're excited about what you are able to afford these health systems.
We're thrilled at the impact that we've seen our clients have, the time they've been able to save, the ROI they get by using this solution. And as Nickie said, it really is about intelligent automation as well. There's so many use cases for this solution, and I look forward to continuing to partner with her and Eggplant on continuing on this journey to find more automation and more use cases, both for our solution as well as the innovation that SIH is in the forefront with.
So Laura, if somebody is listening to this and is just kind of can't wait to figure out how to get this started, how can they get in touch with you?
Well, there's a couple of different ways. Obviously, you can just send me an email directly at lotool@suretest.health. We also are in the process of launching a new website specifically for this solution, but for now, there's a lot of information at suretest.health. Just reach out. Happy to talk, and I'm sure Nickie would be happy to talk to you as well.
Everybody, thank you. It is a new day in this realm. Explore suretest.health and learn more about how you can really transform your test automation. Thanks for joining us.